Okay, so in this video, we will be focusing on the pancreas. Okay, specifically the endocrine pancreas. Okay, now, in fact, the pancreas is also known as a mess gland. The pancreas, we also call it a mess gland. Now, why is it a mess gland? It's a mess gland because this gland actually performs both endocrine and exocrine function. Okay, that's why the pancreas, we also call it a mess gland. Is that okay? Good. It performs both exocrine function and endocrine function. But in this video, we'll be focusing more on the endocrine pancreas. Okay. Now, the endocrine part of the pancreas, we also call it the islet of Langerhans or pancreatic islets. The endocrine part of the pancreas. You can also call it the islet of Langerhans or the pancreatic islet. Why? Because if you look at the entire pancreatic tissue, if you look at certain portions, you see small group of cells will come together, then they form the endocrine pancreas. Small groups, about 5 cells will come together, then they form the endocrine pancreas. Okay, so look at the pancreas. There's the entire pancreatic tissue. So you see about 5 cells will come together over here. Then they form the pancreatic islet or the endocrine pancreas. That's why we call it the islet of Langerhans. Okay, so small group of cells, about 5, will come together, then they form the pancreatic islet. This is the reason why we call it the islet of Langerhans. Okay, it's because of the nature of how, so small group of cells will come together. Okay, so even if we are bringing all these pancreatic tissues together, you realize that they will form a small portion of the entire pancreatic tissue. In fact, these pancreatic islets, if we put all together, okay, they form about 2% of the entire pancreatic tissue. And that tells you the endocrine part of the pancreas is very small. Now, the rest of the portion of the pancreas is made up of the exocrine pancreas. The exocrine pancreas forms about 98%. That should tell you that if we are looking at the entire pancreatic tissue, the exocrine pancreas forms a greater portion of the entire pancreatic tissue, 98% of the total pancreatic tissue. Is that okay? Great. So basically that is what we are talking about. Now, the pancreas is actually located retroperitoneally, behind and then below the stomach and close to the duodenum and then the spleen. This is the spleen. So you see, this is the duodenum. It's more like the head of the pancreas is within the duodenum. In fact, the pancreas has 3 parts. Some books too will say, literatures will say 4 parts, but it basically has about 3 parts. We have the head, we have the body, and then we have the tail. The tail is the portion that is closer, the narrowed portion that heads closer to the spleen. Okay, so this is the tail. This portion is what we call the tail. The portion that is closer to the spleen, this is the spleen. Is that okay? And this area is what we refer to as the body. This area is referred to as the neck. This region is referred to as the neck. So this region, the region that is within the duodenum is the head. And this region is the head. Sorry, the neck. This region is the neck. Okay, and this region that is within the duodenum is the head. And this portion is the body. The rest of the portion closer, narrow and getting closer to the spleen is the tail. So the pancreas basically has 4 parts. We have the head, we have the neck, we have the body, and then we have the tail. Is that okay? So the portion of the pancreas that sits in the duodenum is referred to as the head. Okay, and then the broader portion, okay, is referred to as the body. And we have the neck region over here. Then we have the tail. Is that okay? So if you look at it, you see cluster of cells. They come together, about 5. They come together, then they form the endocrine or the islet of Langerhans or pancreatic islets. These are what we refer to as the endocrine cells of the endocrine pancreas. These ones, 1, 2, 3, 4, 5, 6, 7. We have a lot of them. But if you bring all of them together, they form about 2%, just 2% of the entire pancreatic tissue. They form just 2% of the entire pancreatic tissues. Is that okay? So kindly take note of that. Is that okay? Good. So the pancreas basically has how many parts? 4 parts: the head, the neck, the body, and then the tail. Like I said earlier, the head is the widest part in the curve of the duodenum. Is that okay? Just as I explained, the curved portion that is within the duodenum is referred to as the head. Okay, the neck is short and narrow, and then the body is the central region, and then the tail is a narrow region near the spleen, and it's rich in endocrine cells. We have a lot of the endocrine cells or the pancreatic islets within the neck, the tail region of the pancreas. And like I said earlier, the endocrine pancreas consists of about 1 to 2 million small cluster of hormone producing cells scattered throughout the pancreas, making up about 2% of the total pancreatic tissue. This is what I was explaining. So the endocrine pancreas is very small. It makes up, if you look at the entire pancreatic tissue, the endocrine pancreas is just about 2% of the entire pancreatic tissues. And the endocrine pancreas regulates blood sugar levels, energy metabolism through hormone secretion directly into the bloodstream, playing a vital role in homeostasis. Okay, now the exocrine pancreas, on the other hand, constitutes 98% of the total pancreatic tissue and is primarily made up of what? Acinine and ductile cells. Okay, now the exocrine pancreas is the part or the portion that produces and secretes digestive enzymes, for example, amylase and lipase, and also bicarbonate into the bloodstream through ducts, and that aids in digestion of carbohydrates, proteins, and fats. Okay, so you realize that the endocrine pancreas is made up of the pancreatic islets, and it forms just a small portion, about 2% of the total pancreatic tissues. Is that okay? And the endocrine pancreas is responsible for regulating your blood sugar levels, energy metabolism through hormone secretions that are performed directly or that are released directly into the bloodstream, playing a vital role in homeostasis. Is that okay? And the exocrine pancreas, on the other hand, forms about 98% of the total pancreatic tissue, and it is primarily made up of the acinine and the ductile cells. Is that okay? Good. Now, the exocrine pancreas produces and secretes digestive enzymes, the amylase, the lipase, bicarbonate into the bloodstream, into the duodenum, through ducts, and that aids in digestion of carbohydrates, proteins, and then fat. So you realize that, you see, the endocrine produces and releases their secretions directly into the bloodstream. This is the underlying word, directly into the bloodstream. But the exocrine pancreas produces and releases their secretions into the duodenum, directly into the duodenum. They don't have to go through the blood. That's why we call it the exocrine pancreas. And this is called the endocrine because it is obeying the principle of endocrine system. It is releasing their secretions into the blood. Is that okay? Good. So this is the pancreas. So this is the entire pancreas. So we have the head of the pancreas, we have the body of the pancreas, we have the tail of the pancreas, the narrowed region over here. This is the tail of the pancreas, the portion that is closer to the spleen. Is that okay? So you see the pancreas, this is the pancreatic islet or islet of Langerhans. You see they release their secretions into the blood. You see the arrow is moving into the blood to tell you they release their secretions into the blood. This is another pancreatic islet. You see their secretions are moving into the blood. See where the arrow is, into the blood. But these ones release their secretions. These are some of the exocrine cells. Okay, so we have the pancreatic duct over here. This is the pancreatic duct. This duct over here is called the pancreatic duct. So you see we have the pancreatic duct over here. It comes down here to come and join the bile duct, okay, from the gallbladder. Okay, it comes over here to come and join the bile duct. Then all of them will come and join the common bile duct. So this is the pancreatic duct. It is coming to come and join the bile duct. Then all of them joins the common bile duct. Then the common bile duct is connected into into the duodenum. Okay, so you see we have the acinine cells. Like we said they contain what we call the acinine cells. Is that okay? So we have the acinine and then the ductile cells, like we said earlier. So they release their secretions into the pancreatic duct. Then they come and join the common bile duct, the bile duct also releases secretion to come and join the common bile duct. Then they all release into what? Into the duodenum. Is that okay? So this one do not release their secretion. The acinine cells and the ductal cells do not release their secretion into what? Into the blood. They release their secretions directly into the duct. But then the pancreatic islets, their secretions goes directly into the blood. Okay, and this is the reason why it's considered an endocrine. Okay, so it releases their hormones like the insulin and glucagon directly into the bloodstream. Is that okay? Great. So now let's move on to some details. So now let's focus on the endocrine cells of the pancreas. Okay, so here we'll be looking at the various cells in the pancreas. We will look at both the endocrine cells of the pancreas and the exocrine cells of the pancreas. But our focus is more on the endocrine pancreas because we are looking at the endocrine system. Okay, now with the endocrine cells of the pancreas, we have about 5 endocrine cells. We have the alpha cells, we have the beta cells, we have the delta cells, we have the PP or F cells, and then we have the epsilon cells. Is that okay? So these cells, okay, so you see, this is the endocrine pancreas or the islets of Langerhans. They are made up of about 5 cells. So it's like 5 cells, they come together, then they form the endocrine. Another 5 will come together. Okay, and these are the 5 cells we are talking about: the alpha cells, the beta cells, the delta cells, the PP cells, and then the epsilon cells. The alpha cells, they secrete glucagon. The beta cells, they secrete the insulin. The delta cells, they secrete the somatostatin. The PP or F cells, they secrete pancreatic polypeptides. And then the epsilon cells, they secrete ghrelin. Okay, so the alpha cells secrete glucagon. The beta cells secrete insulin. The delta cells secrete somatostatin. The PP or F cells secrete the pancreatic polypeptide. And then the epsilon cells, okay, they secrete ghrelin. Is that okay? So basically, these are the various cells that we have in the pancreas. Okay, so let's begin with the alpha cells. The alpha cells, they secrete glucagon. Okay, now the work of glucagon is that, the summary of the work of the glucagon is that glucagon basically works to increase your blood sugar level. The work of glucagon is, their entire activity is meant to increase your blood sugar level. The glucagon, they work to basically increase your blood sugar level. Glucagon. Is that okay? And they are able to do this or achieve this through 2 main processes. The first one is glycogenolysis, and then the second one is gluconeogenesis. When we say glycogenolysis, you know, your body can store excess sugar in the form of glycogen. Now, when we say glycogenolysis is a process whereby the stored glycogen are broken down back into glucose for your body to use. And you would understand that when glycogen, which is stored glucose, when they are broken down into glucose, that would help to increase your blood sugar level again. Is that okay? Now, the second process that glucagon uses to increase your blood sugar level is that it uses a process called gluconeogenesis. Gluconeogenesis is a process whereby you are converting non-carbohydrate sources like proteins and fat back into what? Into glucose. That process is what we call gluconeogenesis. Okay, and glucagon help in this. It facilitates these 2 processes. That's the summary of the functions of glucagon. It facilitates 2 main processes, or it uses 2 main processes: glycogenolysis and then gluconeogenesis. Glycogenolysis is when it breaks down stored glycogen back into glucose to be utilized by the body. And then gluconeogenesis is when it goes to non-carbohydrate sources like fats, proteins, and goes to instruct them to be converted, or goes to convert them into glucose. And you realize that these two processes would all help to increase your blood sugar level. And that is why we say that the alpha cells secrete glucagon, and glucagon works to increase your blood sugar level. Now, the next cell is the beta cell. Beta cell will come and do the opposite of the alpha cells. So let's look at what the beta cells do. They secrete insulin. Now, if alpha cells increase your blood sugar level, beta cells produce insulin. Insulin helps to lower your blood sugar level. It also uses two processes: glycogenesis and then lipogenesis. Okay, glycogenesis and lipogenesis. Is that okay? When we say lipogenesis is when you are going to convert, it's like you are going to convert glucose into other nutrients like proteins and fats. That process is what we call lipogenesis. Is that okay? It's like you are converting glucose, okay, back into what? You are converting glucose back into fats, back into other nutrients. Okay, that process is what we call lipogenesis. Is that okay? Good. And it uses another process that we call glucogenesis. Okay, glucogenesis is when you convert glucose back into glycogen. Okay, that process is what we call glucogenesis. Okay, so you see, the beta cells also uses these two processes. Glucogenesis, so it converts glucose into glycogen for them to be stored. And once it is converting glucose into glycogen, definitely glucose levels in the blood will reduce. And another thing is that it can also convert glucose into fats. Okay, the same insulin converting glucose into fats to be stored. Okay, that process is also referred to as lipogenesis, the process of converting excess glucose into fats and sometimes into triglycerides. That process is what we call lipogenesis. Lipogenesis. In fact, this process mainly takes place in the liver and also in some adipose tissues. So you see, the beta cells uses two processes: glycogenesis, converting glucose into glycogen, and then lipogenesis, okay, converting excess glucose into fat and triglycerides to be stored in the body. So these are the two main processes that the beta cells uses to help lower your blood sugar level. And then the alpha cells also secrete glucagon, and it also uses two main processes to help increase your blood sugar level. Okay, it will use a process called GLYCOGENOLYSIS and then GLUCONEOGENESIS. So glycogenolysis is breaking down glycogen back into glucose, and then gluconeogenesis is creating glucose from non-carbohydrate sources like protein. So it will go and look for proteins and go and look for fats and convert them back into glucose. That is what glucagon will do. Insulin too will use two main processes: glycogenesis, okay, and lipogenesis. Glycogenesis in the sense that it will convert glycogenesis. Look, glycogenesis. Is that okay? So it will convert what we call glucose back into glycogen. And at the same time, it can also help convert excess glucose into fat and also triglycerides. Okay, so these are the functions of the alpha cells and then the beta cells. Is that okay? Then we have the delta cells. Okay, the delta cells, they secrete somatostatin. Okay, so what somatostatin does is that somatostatin actually regulates both glucagon and insulin. So anytime your body is producing a lot of glucagon, somatostatin will come and neutralize. Your body is producing a lot of insulin, or your pancreatic islets producing a lot of insulin, somatostatin will come and act as a neutralizer. Is that okay? So they actually regulate the hormones. They regulate the hormones. They also regulate the activities of the exocrine pancreas, the somatostatin. It also regulates the activities of the endocrine pancreas in terms of the digestive enzymes release. Is that okay? Great. Now we have the PP or F cells. They secrete pancreatic polypeptide and they control the pancreatic enzyme release. Okay, they also control the pancreatic enzyme release. Okay, so like I said, the delta cell secretes somatostatin, and the primary function of the somatostatin is basically to control glucagon and insulin release. So we say that they regulate the hormones. They regulate the hormones secretion. That's the glucagon and insulin secretion. Is that okay? Good. Then we have the PP cells or F cells. They secrete pancreatic polypeptide. And the pancreatic polypeptide, they control the pancreatic enzyme release and affect appetite and GI motility. Is that okay? Then we have the epsilon cells. They secrete ghrelin. In fact, this cell or this ghrelin basically stimulates hunger, regulate energy homeostasis, and act mainly on the hypothalamus. Okay, so basically, in endocrine pancreas, our main focus usually is on the alpha cells and then the beta cells. So remember that the beta cells would work to lower your blood glucose levels. The alpha cells will work to increase your blood glucose levels. Is that okay? Why? Because the alpha cells secrete glucagon, and glucagon undertakes two main processes: glycogenolysis. Glycogenolysis. Is that okay? Meaning breaking down stored glucose back into what? Breaking down glycogen back into stored glycogen back into glucose. Okay, so you know glucose is usually stored in the liver in the form of glycogen. So when glucagon is being produced, it will go and act on the liver so that the liver converts the stored glucose, which is the glycogen, back into glucose. That process is what we call glycogenolysis. The second process glucagon uses that it uses gluconeogenesis. It goes to proteins and fats and go and convert them into glucose. And that would also help to increase your blood sugar level. That process is what we call gluconeogenesis. Is that okay? And then the beta cells, they work to secrete insulin, and the insulin lowers your blood glucose level. Is that okay? How is he able to achieve that? He also uses two processes: glycogenesis and lipogenesis. Lipogenesis means you are converting excess sugar into fats, okay, or into triglycerides. Is that okay? And then glycogenesis is when you are converting excess glucose into glycogen. That process is what? And once you are converting excess glucose into glycogen, you end up reducing the glucose. That's why we say beta cells or the insulin secreted by the beta cells, they help to lower your blood sugar level. And then the delta cells is like the control. It controls the beta cell activities and also controls the alpha cell activity. It regulates the glucagon activity and also regulates insulin activity. So when we have more glucagon, somatostatin will come and control it. If we have more insulin activity, somatostatin will come and control it. Then we have the PP cells. They secrete pancreatic polypeptide, and this cell activity regulates the exocrine cells. Okay, this cell, the pancreatic polypeptide secreted by the PP cells, they regulate the exocrine portion of the pancreas, the activities over there, whether they should secrete or they shouldn't secrete. And then the epsilon cells, okay, they help to stimulate hunger, regulate energy homeostasis, and they act mainly on the hypothalamus. Okay, now let's do a bit of concentration on the exocrine pancreas. So the exocrine pancreas, we have about 4 exocrine cells in the exocrine pancreas. We have the acinine cells, we have the ductile cells, we have the central acinine cells, and then we have the zymogen granule storing cells, which are within the acinine cells. In fact, the acinine cells secrete digestive enzymes like the amylase, the lipase, and then the proteases. Okay, and the acinine cells, the enzymes they are responsible for breaking down carbohydrates, fats, and proteins. Then we have the ductile cells. They secrete bicarbonate-rich fluid that helps neutralize stomach acid in the duodenum. Okay, and this is the reason why you see when food is coming from the stomach into the duodenum. It's mixed with hydrochloric acid. Imagine the food moves in there and there is nothing like a neutralizer. Your intestines, including the duodenums, are going to wear away. Okay, good. And that's why we have the ductal cells that secrete the bicarbonate-rich fluid, which help to neutralize the stomach acid secretion in the duodenum. Okay, then we have the central acinal cells. Central acinal cells. These are specialized ductal cells at the junction of the axonal and then the ducts. Okay, they modify and help transport pancreatic secretions. Is that okay? Then we have the zymogen granule storing cells. They are within the acinal cells. And these cells, they store inactive enzyme precursors. Example, trypsinogen. They store the precursors of the inactive enzyme precursors. And they also prevent autodigestion of the pancreatic tissues. Is that okay? Great. So basically, these are the endocrine cells and then the exocrine cells. So the endocrine cells, we have the alpha cells, they secrete glucagon. The beta cells secrete insulin. The delta cells secrete somatostatin. The PP or F cells secrete pancreatic polypeptides. The epsilon cells secrete ghrelin. So we have the alpha cells, the beta cells, the delta cells, the pancreatic polypeptide, the PP cells, the epsilon cells. Is that okay? So the glucagon works to increase your blood glucose level. The insulin works to lower your blood glucose level. The delta cells, they inhibit the action of both insulin and glucagon. Is that okay? Then the PP or pancreatic polypeptide cells, they control the activity of the endocrine pancreas. The epsilon cells secrete ghrelin, which mostly act. This cell, the ghrelin mostly acts on the hypothalamus to stimulate hunger, and it also plays a role in regulating energy metabolism. Then we have about 4 cells in the exocrine pancreas. We have the acinal cells, the ductal cells, the central acinal cells. We have the zymogen granule storing cells. These are within the acinal cells. They actually store the inactive enzyme precursors like the trypsinogens. The inactive enzymes that are within, usually in the acinal cells. Okay, in the acinal cells, the digestive enzymes within these cells, they are usually inactive. So they should be stored somewhere. They are stored in the zymogen granule storing cells, which are within the acinal cells, because if the enzymes are activated within the pancreas, it will cause autodigestion. Is that okay? So they are stored here in an inactive form, so that when they are secreted away from the pancreas, they get into the duodenum before they are activated. Is that okay? Before they are activated. So they are usually produced in the acinal cells, but they are inactive. Because if they are active in the pancreas, they will cause autodigestion of the pancreas. Is that okay? So they are stored over here. So the digestive enzymes are stored over here as precursors or inactive enzymes. Okay, good. So that when they are released, then they are activated. Okay, in that environment. Good. Then we have the ductal cells. They secrete the bicarbonate-rich fluid, which help neutralize stomach acid in the duodenum. Then we have the central acinal cells. They are specialized ductal cells at the junction of the acinal and ducts. They modify and help transport pancreatic secretions. Is that okay? So basically that is it. Okay, so let's look at the cells again. So we have the alpha cells, they secrete glucagon. We have the beta cells, they secrete the insulin. We have the delta cells, they secrete somatostatin. Okay, and then we have the exocrine pancreas. They contain the acinal cells, the ductile cells. You get the acinal cells, the ductile cells. Okay, so basically that is it for. So you see we have the PP cells. Okay, the PP cells, pancreatic polypeptide. We have the E cells, they secrete the ghrelin. Is that okay? So the beta cells, they secrete insulin, and insulin works to decrease your blood sugar level. We have the alpha cells, they secrete glucagon. Glucagon works to increase your blood sugar level. We have the delta cells, they secrete somatostatin. Somatostatin regulates insulin, inhibits insulin and glucagon activities. The PP cells, they secrete the pancreatic polypeptide, and they regulate the activities of the endocrine cells. Okay, then we have the ghrelin, which acts mostly on the hypothalamus, and they play a role in hunger. Okay, hunger stimulation. They work on a lot on the hypothalamus. So basically, these are the endocrine and then the exocrine cells. Okay, so we have some key metabolic processes, hormonal balance, and target organs. Okay, so these are the key metabolic processes that takes place in the pancreas, specifically the endocrine pancreas. Like I said, gluconeogenesis. So this is what we were explaining, gluconeogenesis. Okay, so when we say gluconeogenesis, like I said earlier, is a process of synthesizing glucose from non-carbohydrate sources. And this is done by the glucagon. This is done under the influence of glucagon by the alpha cells. Is that okay? Gluconeogenesis, making glucose from amino acids. You get it? Making glucose from non-carbohydrate sources. You are making glucose from, the end product of protein metabolism, amino acids, and then fat, lipids. So making glucose, okay? You are going to make glucose from non-carbohydrate sources. That process is what we call gluconeogenesis. Okay. So anytime the levels of glucagon increases, this process would occur. So anytime the levels of glucagon increases, okay, this process would occur. Gluconeogenesis. Okay, a process whereby glucose is made from non-carbohydrate sources. Okay, so sources like fats, sources like proteins, we are converting them back into glucose. And anytime glucagon levels increases, this process would occur, gluconeogenesis. That is why it is showing over here. And then we have glycogenolysis. Glycogenolysis is when you are going to convert stored glycogen back into glucose. Glucose can be stored in the liver as glycogen, so that when the body is in need of it, okay, glucagon will act on the liver and convert them back into glucose. That process is what we call glycogenolysis, breaking down stored glycogen back into glucose. And that process can help increase your blood sugar level. And anytime glucagon levels increases, that process would occur. Glycogenolysis would occur. So that should tell you that anytime glucagon level increases, two processes, metabolic processes, can occur. Gluconeogenesis and then glycogenolysis. These two processes will occur. Okay. Then we have another process we call glycogenesis. Okay. Glycogenesis is when we say glycogenesis. Okay. Glycogenesis is when you are making glycogen from glucose. It's like you are converting excess glucose into glycogen to be stored. That process is what we call glycogenesis. You are converting excess glucose back into what? Into glycogen to be stored. And that process will help decrease your blood sugar level. So that activity is performed by insulin. So anytime insulin levels increases, glycogenesis would occur. Anytime insulin levels increases, glycogenesis would occur. Okay, good. Then we have another process we call lipogenesis. Okay, lipogenesis is when you are converting excess glucose into fats and triglycerides to be stored. You are converting excess glucose into fats and triglycerides. That process is what we call lipogenesis. Okay, you are making fats, you are making triglycerides, okay, using glucose. Okay, so anytime insulin levels increases, this process also takes place. Okay, so in summary, we can say that based on these two things, glycogenesis and lipogenesis, okay, which would all help decrease your blood sugar level. We can say that insulin is a hypoglycemic hormone. It lowers glucose levels. And we can also say that glucagon is a hyperglycemic hormone, meaning it raises your blood glucose level. So this is the summary of the whole metabolic processes. So we can say in summary that insulin is a hypoglycemic hormone. It lowers your blood sugar level. Glucagon is a hyperglycemic hormone. It raises your blood glucose level. And now these are the target organs for these hormones, insulin and glucagon. It acts on the liver. Okay, so during a process that we call glycogenesis, insulin will act on the liver. Okay, so that it would act on the liver so that it converts excess glucose back into glycogen to be stored in the liver. Is that okay? Another thing is that when glucagon levels increases, glucagon will also act on the liver and convert excess stored glycogen back into glucose to be used by the body through a process that we call GLYCOGENOLYSIS. Is that okay? GLYCOGENOLYSIS. So you see, these hormones basically act on the liver. They also act on muscles. Is that okay? They also act on muscles. Okay, so because we can have some of the glycogen being stored in what? Being stored in muscles, like skeletal muscles. Is that okay? And glucagon can act on this glycogen and break them down back into glucose to be utilized by the body. Is that okay? Good. So basically, these hormones usually act on the liver, they act on muscles, they act on adipose tissues, they act on brain, and they act on the kidneys. Is that okay? So basically, these are the metabolic processes that occur because of insulin and then glucagon, okay, in the body. Now let's look at the mechanism of insulin secretion in the pancreatic beta cells. The mechanism of insulin secretion in the pancreatic beta cell. Now with the mechanism of insulin secretion in the pancreatic beta cell, it starts from glucose. So we have glucose in the blood. So here in this diagram, what we need is insulin. We are going to see how the beta cells, they produce the insulin. We are going to look at how the beta cells, they release the insulin. Okay, so the insulin is within the beta cells already. We are going to look at how they are being released, the mechanism, the process by which the insulin is being released. So the whole thing starts from glucose. First of all, glucose have to enter the beta cell. So this whole diagram here is representing the beta cells. So first of all, after you've taken a meal, okay, blood glucose levels will definitely increase. Once you eat, your blood glucose levels would increase. Okay, now when your blood glucose levels increases, now glucose will now enter the beta cells through a channel that we call the GLUT2 transporter. This channel, or it's like a gate, we call this channel the GLUT2 transporter. Is that okay? Or what we call glucose transporter 2, or the second glucose transporter, GLUT2 transporter. So glucose enter the beta cells through the GLUT2 transporter. Is that okay? It enters through this transporter. So the moment you eat a meal, your body makes glucose, your glucose levels increases. Glucose enter the beta cells through the GLUT2 transporter. Is that okay? Now, what will happen is that after the glucose have entered the cell, glucose metabolism and ATP production will be the next activity to take place. So inside the beta cell, what will happen is the glucose that has entered the beta cell, they will be phosphorylated. They will be phosphorylated by an enzyme that we call glucokinase. Okay, so they will be changed by this enzyme. We call it glucokinase. This enzyme will convert the glucose into glucose 6-phosphates. Okay, it will convert it into glucose 6 phosphates. Okay, now once it converts it into glucose 6-phosphate, glycolysis will occur. Okay, it will enter what we call a glycolytic pathway. It's entering the glycolytic pathway so that it finds its way into the mitochondria for oxidative phosphorylation to take place. Okay, now what will happen is that when glycolysis occurs, now this glucose 6-phosphate is coming into the mitochondria. Okay, and at the end of the day, this metabolic process will lead to an increased production of ATP. Okay, so the glucose enters to the GLUT2 transporter. Okay, then glucose kinase will convert it into glucose 6-phosphate. Then glycolysis will occur, whereby the glucose 6-phosphate enters the mitochondria. As it enters the mitochondria, energy will be generated. Okay, so the ATP levels would increase, or ATP ratio would increase. Okay, so the ATP levels will rise, they will increase. Is that okay? And we have a channel over here, a channel down here. We call it ATP sensitive potassium channel. Once the ATP levels increases, okay, the ATP sensitive potassium channel will close. So you see here is negative, meaning this channel has closed. And the moment this channel closes, is that okay? What will happen is that it will prevent potassium from leaving the cell. And if potassium is not able to leave the beta cell, depolarization of the cell will take place. Okay, so the beta cell will now depolarize. And the moment beta cell depolarize, we have a voltage-gated calcium channel within the beta cell. This channel, we call it voltage-gated calcium channel. Once the beta cell depolarizes because of the increased levels of the ATP, okay, this calcium channel, voltage-gated calcium channel, will open so that calcium enters the cell, the beta cell. And once calcium enters the beta cells, the insulin-containing granules, is that okay? Okay, there is going to be a burst of insulin from the releasing granules. And we call the releasing granules the insulin-containing granules. There is going to be a burst of insulin release, and then exocytosis will occur so that insulin is released outside of the beta cell into the bloodstream. Okay, this is the summary of the beta cell activity. It's very simple. So the whole process starts when you eat a meal that contains a lot of glucose. So when you take in a meal that contains a lot of glucose, glucose enters the beta cell. Okay, so the whole process starts when glucose enters the beta cell. Okay, so glucose will enter the beta cells through this GLUT2 transporter. GLUT2 transporter. Now, the glucose will be converted by glucokinase into glucose 6-phosphate. Okay, that is phosphorylation. Then glycolysis will occur, whereby the glucose 6-phosphate goes to the mitochondria. Okay, goes to the mitochondria of the beta cell. Okay, then that activity would help increase ATP production, energy production, because the mitochondria also needs the glucose for energy production. So energy production in the mitochondria of the beta cell will increase. Okay, so ATP levels will increase. And once ATP levels increases, there is a channel here, we call it ATP sensitive potassium channel. This channel allows potassium to leave the beta cell. But the moment glucose enters and ATP levels increases, this channel will close. That is why we have negative over here. The channel closes. So there is a negation of the channel so that potassium can no longer leave the beta cell. Okay, and once potassium become more in the beta cell, this cell will depolarize. Okay, it will depolarize. And the moment the cell depolarizes, another channel will open. We call it the calcium channel. Is that okay? This is a calcium channel. It's a voltage-gated calcium channel. This channel would open, or you can call it L-type calcium channel. It will open. So you see it's plus. Once this channel open, calcium from the outside will enter the cell. And that would go and force the release of what? Of insulin from the insulin-containing granules. Then exocytosis will occur so that the insulin will leave outside of the beta cell. This process is what we call the mechanism of insulin secretion in pancreatic beta cells. Is that okay? Great. Now, there's a summary table showing the parts of the pancreas, specifically the distribution of the cells, the various cell types, the hormones they secrete, and then their functions. Okay, we've done all these before. So the alpha cell secrete glucagon. Okay, the beta cell secrete insulin, delta cell secrete somatostatin, PP cell secrete pancreatic polypeptide, epsilon cell secrete ghrelin. So we have the glucagon. They act basically on the liver. Glucagon basically works to raise your blood glucose by stimulating glycogen breakdown and then gluconeogenesis. Okay, insulin also acts on the liver, muscles, and adipose. They work to lower your blood glucose by promoting glucose uptake and storage as glycogen or fat. Okay, then we have the delta cells. They secrete somatostatin. Okay, and then the somatostatin, they actually inhibit the activities of insulin and glucagon, and they also play a role in inhibiting the activities of the digestive hormones. Okay, then we have the PP cells, pancreatic polypeptide. Okay, they actually regulate the activities of the digestive organs, the pancreas and other digestive organs. They regulate pancreatic enzyme secretion. They also play a role in regulating GI motility, gastrointestinal motility. The epsilon cells, ghrelin, they act on the hypothalamus. They stimulate hunger and regulate your energy balance. Then we have the acinine cells. Okay, the exocrine cells, we have the acinine. The main cells in the exocrine is the acinine and the ductile cells. The acinine cells secrete the digestive enzymes. They release them into the duodenum. They break down carbohydrate, fats, and proteins in the small intestines. Then we have the ductile cells. They secrete bicarbonates, and this bicarbonate is released into the duodenum. It works to neutralize stomach acid secretions to provide optimal pH for enzyme action. Now, remember that we have hypothalamic somatostatin. In the endocrine system, we realize that we also mentioned that the hypothalamus also produces somatostatin, growth hormone releasing inhibiting hormone, which also regulates hormonal output from the pituitary. So, understand that we have a difference between the somatostatin produced by the pancreas, and we have a difference between the somatostatin produced by the hypothalamus. That is something you should pay attention to. So the hypothalamic somatostatin regulates hormonal output from the pituitary, whilst the pancreatic somatostatin helps balance blood sugar and digestion by moderating insulin, glucagon, and digestive secretions. Is that okay? Great. So basically that is it for the endocrine pancreas, or the pancreas in general. Now, these are the clinical significance. Understanding the endocrine pancreas would help you to understand conditions like diabetes. Okay, conditions like diabetes. In diabetes, we have two forms of diabetes. Diabetes type 1, which we also call the insulin-dependent diabetes mellitus, or you can call it the juvenile onset diabetes. And then we have the diabetes type 2, the non-insulin dependent diabetes mellitus, or the adult onset diabetes. Is that okay? So with the diabetes type 1, usually the diabetes type 1 is when it's more like your own immune system is destroying the insulin producing beta cells. Okay, so the beta cells, your own immune system is attacking the beta cells. Is that okay? In the pancreas. Okay, so at the end of the day, what will happen is your body will produce little to no insulin. Okay, you see that your body will produce little insulin or no insulin at all. So at the end of the day, if your body is producing little insulin, then it means that glucose is going to accumulate in your blood, because glucose is what helps to reduce or decrease your blood sugar level. Okay, so you can imagine someone having an autoimmune disorder whereby your immune system is destroying the beta cells. At the end of the day, your body will produce little insulin. So if insulin is little or reduced, then glucose levels will increase in your blood. That is what happens in that form of diabetes. Then we have the type 2 diabetes mellitus, or the adult onset diabetes. In that situation, the beta cells, there is nothing wrong with the beta cells. The beta cells are producing normal. The insulin is being produced. Just that your body cells become resistant to the insulin. So that condition, you can also call it insulin resistance. Okay, so the person is not having any problem with the beta cells of the pancreas. Is that okay? The person is okay. The beta cells are functioning normal. Just that the person's body cells are less resistant. They are resisting. Okay, they are resisting. They are more resistant to the insulin that is being produced, or they are unable to use the insulin that is being produced. In such a situation too, glucose levels would also increase. Is that okay? So understanding the pancreatic anatomy, the endocrine pancreas, would help you appreciate and understand how these conditions actually occur. Okay, so if you are imagining someone with diabetes, then you can think that, okay, diabetes, then it could be that the body is producing it's not producing adequate amount of insulin. If someone is not producing adequate, because insulin is what decrease your blood sugar level. So if someone's blood sugar level is very high, then what it means is that the person's body is producing little or no amount of insulin. And that situation is the type 1 diabetes, whereby the person's immune system starts attacking the pancreas. Okay, the beta cells of the pancreas. And when that happens, insulin levels will reduce. Okay, and insulin levels, when they decrease, at the end of the day, glucose levels will increase, because insulin is what is going to help decrease your blood sugar level. Okay, it's a hypoglycemic hormone. Have you forgotten? We mentioned that insulin is a hypoglycemic hormone. Okay, we mentioned that over here, that insulin is a so it lowers your blood sugar level. So if someone is having diabetes, high blood sugar level, then it should tell you that it is possible that the beta cells are not producing the insulin. It could also be that the beta cells are producing the insulin, but the cells are unable to use it. That is the type 2. Non-insulin dependent. Listen to the name, non-insulin dependent, meaning in such a situation, the beta cells are functioning all right, but the cells are resistant to the hormones that are being produced by the beta cells. That one too, still, the hormone will not work. So at the end of the day, sugar will dominate. Do you get it? If you understand the pancreatic islet anatomy and physiology, you would appreciate how these conditions occur. And that is part of the clinical significance. And it will also help you to appreciate the pharmacology relating to the endocrine system of the pancreas. Is that okay? So for example, you know that sometimes people come with diabetes and we are giving them insulin. You understand why we are giving them insulin. We are giving them insulin because insulin is a hypoglycemic agent, meaning we want their blood sugar level to decrease. That's why we are giving them insulin. If we have to give someone glucagon, then it means they, on the other hand, their blood sugar level is very low. Then we can give those ones glucagon, a synthetic form of glucagon. If we are giving a patient glucagon, then it means their blood sugar level is very, very, very low. Then we are giving them glucagon, so that glucagon will go and act on the liver, convert stored glycogen back into glucose. Okay, we'll also go and act on fats and other, non-carbohydrate sources, convert the stored sugar there, or convert those nutrients back into glucose to be used by the body. Do you get it? Now, so if you understand the pancreatic anatomy, you will appreciate how all these things occur. And as a nurse or a midwife, it will help you to be able to manage patients with these conditions properly. Okay, you'll be able to manage patients with these conditions properly. Is that okay? Great. So basically, that is it for the endocrine pancreas. Okay, so in summary, the endocrine pancreas, we have these cells, 5 cells in the endocrine pancreas: the alpha cells, the beta cells, the delta cells, the PP cells, and then the epsilon cells. These are the cells we have in the endocrine pancreas. And in fact, the entire endocrine pancreas forms about 2% of the whole pancreatic tissue. And then the exocrine forms 98% of the entire pancreatic tissue. That tells you that the exocrine pancreas is the largest portion of the entire pancreatic tissue. Okay, and then the endocrine is the smallest portion of the entire pancreatic tissue. So the alpha cell secrete glucagon, the beta cell secrete insulin, the delta cell secrete somatostatin, the PP cell secrete pancreatic polypeptide, the epsilon cell secrete ghrelin. Is that okay? They secrete ghrelin. Okay, so basically that is it for the endocrine pancreas and then the exocrine pancreas. All right, so thank you for your time, making time to watch this video to the very end. Okay, support this channel by clicking on the like button. Make sure you subscribe to the channel so that anytime there is an update, you get a notification. And also make an attempt or do well to share content on this channel to your colleagues who may find this content very useful. Okay, so see you in the next video. Thank you. Bye-bye.